Hello, my name's Daniel. I'm going to be your nurse today. Thank you for coming into our clinic. We're here to help you, and let's get started, okay? So, what brings you here today?
I've been noticing I'm more short of breath and have increased fatigue when I do physical activity over the past couple of weeks. I get out of breath walking up the stairs, and I think it's getting worse. Started about 3 months ago, but it definitely is worse today.
Okay. So I just have briefly gone over your chart, and it mentions in your past history that you have hypertension, hyperlipidemia, type 2 diabetes, and coronary artery disease. Within a few months ago as well, you had an echocardiogram, I think, and it showed an ejection fraction of less than 40%. So that may be attributed to it due to your diagnosis of mild heart failure. So you're here today. We're going to figure out what's going on. Possibly give you some recommendations, maybe some consults. But as of right now, we're going to do a full physical assessment because you can't just treat one thing by itself. So we're going to do a holistic assessment, and as I do it, I'll kind of explain everything I'm doing, and you can ask any questions that you have. How does that sound? Good?
Good.
All right. Okay. So as a general assessment, and again, I'm just going to say what I'm doing because just to inform you. But as a general assessment or a general survey, you seem a little more lethargic than prior visits that I've worked with you. Um, you seem like you kind of walked in a little slower, and right now you seem a little out of breath. You're breathing a little bit faster, maybe a little bit shallower, and you're a little more pale. Your skin doesn't look as flush. But all that can be attributed to your heart condition and all these different comorbidities that you have. But like I said, we're gonna kind of get to the bottom of it and figure out a game plan for you. Also, the medical assistant did some vital signs on you, and your blood pressure was a little elevated, 170 over 92. Your heart rate was 124. Respirations were 28 and shallow, and your temperature was 38.8 degrees. And actually, what was also noted is that you, over the last 3 months, you're about 10 pounds heavier. So we'll kind
Whoa.
of exactly. We'll kind of determine, the causes of all of these, and like I said, we figure out a game plan from there. So I'm gonna just start now with neurological assessment. So neurologically, can you tell me your full name?
Patty Smith,
Okay, and Patty Smith. Where are we right now?
the clinic.
Okay, and why?
Well, it's because I'm lightheaded, out of breath, puffier, dizzy. I mean, the list goes on.
Oh, okay, all right. And then, can you tell me the date?
February 10th, 2017.
I'm sure that's correct. Okay, can you do me one more favor? I'm just gonna take a quick peek at your eyes, your pupils. Just stare at me. Okay. All right. Sounds good. Can you follow my finger? All right. Can you smile for me? Stick out your tongue. All right. Okay. So let's see, where do we go from here? So otherwise, neurologically, you walked in, you didn't seem to be favoring one side. You don't show any stroke-like symptoms. Do you have any other problems, you think, neurologically?
No, just my lightheadedness.
Okay, and that usually happens at any time, or is it when you stand to
It's when
sit?
I stand from a seated position.
Okay. All right. So let's see. What else can we do?
Oh, I also have been having some blurry vision.
Okay. Does that also happen when you stand, or is it
Yeah, when
okay?
I stand and get lightheaded.
Okay. And you kind of see the spots?
Yeah,
Okay.
black.
Okay. All right. Now what I'm going to do is I'm going to assess your heart real quick. I'm going to look, or I'm going to listen. Um, Okay, don't move. Breathe normally. Okay. Mhm. 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 Okay. All right. So it sounds like your heart's beating a little quicker than normal. You have a little murmur. Have you had that before?
No, I
No?
don't think so.
Okay, there's a little murmur present, and sometimes just there's so much a little bit extra fluid in with your heart condition that some of the fluid kind of backs up, and there's some fluid regurgitation within your heart. So um, we'll keep assessing and go from there. I'm gonna assess your pulses real quick and see. Okay, yeah, your pulses are a little weak and thready, kind of irregular. I'm gonna check your pedal pulses. Okay.
Whenever I work out, I feel palpitations a lot, but I don't
Okay.
do much exercise.
Okay. Okay. Well, I'm gonna make a note of that. Thank you. Um, let's retake your blood pressure because when you came in, it was high, and you are also on some medications. So I want to see if we're gonna need to readjust those medications while you're here. Um, well, we'll see. I'll pretend the sweater's not on. All right. Mm-hmm. Go ahead and hold my arm. Hold my arm. Okay. I don't. All right. See what this is.
Ow.
Okay. Okay, so that's still a little high. Now it says in your chart that you're on a couple medications. I believe it's lisinopril, and then you're on a little bit of metformin and Lipitor. Your lisinopril, are you taking? Well, one, are you taking all these medications regularly?
I don't know.
Okay. Well,
Which pill is it? The blue one or the white one?
probably all of them. No, but okay, so we'll see where we go from here. But maybe taking the medications on a regular basis would behoove you. Okay, but we'll talk to the pharmacist and the doctor and see what their recommendations are. Let's see. Next, we're gonna assess your lungs, and then so I'm gonna have you take some deep breaths for me. Okay. There you go.
I feel like I'm constantly short of breath, especially after walking up my stairs or intense activities. I no longer work out because I don't have the stamina.
Okay, I'll ask all those questions when you're done. When I'm done listening to your lungs, can you
Oh.
step forward so I can listen to your back? There you go. Okay, deep breath. Okay, do you feel like you're a little congested?
Yeah, I usually have a persistent dry cough.
Okay, it sounds a little, as we would call rails. So sometimes when your heart doesn't pump as effective, there's some fluid buildup and some congestion in the lungs. But like I said, we may give you some medications for that to kind of get rid of some of that extra fluid to help unload the burden on the heart. Let's see. So now I'm going to actually have you lay down, and I'm going to I'm going to assess your stomach.
I can't lay down. I can't breathe when I lay down. I sleep upright in a chair these days.
Oh, okay. Okay. Well, we won't make you lay down. I'll just kind of assess you sitting up. Yeah, you having any tenderness?
Oh, yeah, that hurts right there.
Okay. Okay. Kind of by your liver?
Yeah, is that side?
Yeah. Okay. So sometimes, again, the heart's not pumping very effectively, and there'll be fluid up not only in your lungs, but your legs, but the rest of your body as well. So are you feeling like full at night, or is your diet still the same?
I don't really eat that much.
Okay. Yeah, because you're probably kind of feeling a little bloated.
Yeah, I'm never really hungry.
Okay. Let's see. And then again, have you had any urination or menstrual pattern changes in the
Well,
last
I'm
couple months?
constantly having to pee in the middle of the night. I go to the bathroom so much more.
Okay, okay. Well, that's just kind of your body, your kidneys kind of trying to make up for all the extra workload of the heart. So your heart's got to pump all this blood, all this fluid around your whole body, and right now it's not really doing its job. So the kidneys are trying to help out the heart by getting rid of some of that fluid by having you pee a lot.
It's
So
annoying.
I can imagine. So we'll probably do some lab tests as well, just to make sure all your electrolytes are okay and your kidneys are actually functioning well. So I'm gonna just test your muscle strength. You said that you used to go to the gym, but not so much lately. But can you do me a favor and put your arms out and then squeeze my hands? Pull me towards you. Push me away. Push, push, push. Okay. I'm gonna have you lift up your legs. There you go. Okay. What about the right one? All right. There we go. It feels a little weaker than the last time I saw
I
you.
definitely am weaker. I can't even really go for walks anymore. I just am too tired, and then after that I have to nap.
Okay, okay. Yeah, it seems like your muscles may be atrophied a little bit in the last couple months. So maybe we'll do a PT OT recommendation to see what will work best for you and that you'll also be able to tolerate. Just noticing, feeling your hands and your feet and whatnot, your hand, all your extremities feel a little cold to the touch, and your cap refills are less than 3 seconds. Um, have you noticed your hands feeling cold all the time?
Yeah, I'm always freezing.
Okay. Your lower legs also have some status dermatitis. Has that been going on long as well?
For about the past couple months.
Okay. Okay. Can I take a quick peek at your teeth? Okay, a little bit of tooth decay. Okay, that's a risk factor
Oh
for heart
no.
disease. Yeah, but maybe a dentistry consult as well. We want to make sure that doesn't progress. And then also, really quickly, it appears that you have a little bit of bulging on your neck. Sorry, my hands are cold too. Maybe I might have heart failure. Have you noticed like the veins in your neck bulging out lately?
Yeah.
Yeah, kind of when all these other symptoms happen,
Yeah.
probably. Okay, okay. So let me just review kind of the symptoms you presented with, okay? So you have poor sleep, you're tired all the time, fatigued, sitting to standing, you have some orthostatic hypotension, poor perfusion in your extremities because they're super cold, and now you have some weak, thready pulses that are irregular. Let's see, what else did I have written down? Poor diet as well, some stomach tenderness. Am I missing anything, or do you have anything to add to that?
No, I think that covered a lot of it.
Okay. And we kind of went through every type of system or symptom individually with each system and explained why that kind of occurs with the heart failure patient. So not only physically, but we want to make sure you're mentally healthy too. Healthy mind, healthy body, emotionally, spiritually, and all of that. This isn't a one-stop shop. We want to make sure you're healthy all around. So, mentally, from a mental standpoint, do you feel good? Do you have good coping mechanisms? How are you feeling right now?
I'm kind of sad and depressed. I mean, I used to be so active, and now I just can't really do anything because I don't feel well enough to go for a walk or go anywhere. And even if I do go, I can't last long when I'm out. So, and then I get short of breath, lightheaded, and I'm afraid I'm going to pass out.
Okay. Yeah, we'll, like I said, work with PT to kind of determine how much activity that's safe for you. Because you don't want to overexert yourself, pass out, and fall. Because that would lead to much, much worse problems as well. So since you said that, you're feeling kind of down, just hanging out with friends, do you have a social life where maybe people come visit you, or any type of kind of outlet out of this?
No, I've kind of isolated myself from my friends because I can't really keep up with them. And I have a poor body image because of how swollen my legs are.
Okay. What about family? Do you have a good support system there?
Yeah.
Okay. Okay. Well, maybe we'll do. Maybe we can recommend maybe some social work and maybe some support groups. I'm sure there's support groups out there where there's people also being affected by this as well. Um, so spiritually, in your chart, it said that you were very involved in your church, putting on events and whatnot. Are you still involved in the church?
Not really. I've kind of just stopped doing that as well because I don't understand why is this happening to me.
Okay. Okay. Well, so overall, just to kind of summarize some things, based on your history, you have a couple of risk factors for um, your heart disease diagnoses and its progression. So you've had high blood pressure, hyperlipidemia, um, controlled at the moment type 2 diabetes, and coronary artery disease. In your chart too, I also saw that your history showed your parents have both died of heart attacks.
Yeah, they did.
Okay. Okay. So going on from here, going from here, we need to make sure that you are one. We'll get some consults from a couple of teams. We're going to talk to cardiology. We want to make sure that your heart's healthy enough for to increase your physical activity. Before you were working out 5 times a week for 30 minutes each, maybe if we start out 2 times a week for 10 minutes a week, just something to kind of get you back and feeling better. Also, we'll consult dietitian or nutrition, and kind of maybe revamp your diet a little bit. Maybe limit the sugar intake, the salt intake, and the high fat content of foods, and switch to a more well balanced, vegetable based, fruits and whole grain diet. Like I said, we'll talk to social worker. Maybe there's some support groups for you as well. Um, but it seems you're here today, and that seems like, and it shows that you want to get better. So showing up is half the battle. So let us help you from here on out. A multidisciplinary team was probably the best approach to this. So as we go right now, what we're going to do is we're going to draw some labs. We'll do another EKG test. We'll do a repeat echocardiogram, most likely. We'll have a physician come talk to you, specifically probably from cardiology. There may be some medications they may want to give you, something to maybe get rid of this excess fluid, maybe some Lasix. And we'll kind of just do a workup. Depending on what they find, maybe they may have to spend the night here for a night. Maybe they might want to do another follow-up. But that's the plan, and we want to make sure that you're healthy throughout.